Good afternoon, everyone. I'm Ashley. I'm going to be person 1.
I'm Jennifer. I'm going to be person number 3.
And I'm Dara. I'll be person number 2.
Today we are going to talk about the drug Eldepryl. If you pick up your Mosby's book and look in the index on page 1408, you will see the drug Eldepryl. This will direct you to page 1187, which will show you the generic brand or the generic name Celgylene hydrochloride. This drug relieves the signs and symptoms of Parkinson's, and this drug is a must-need to put on Jennifer's medical history form because of its fatal effects when administered with any opioids. When this medication is mixed with other drugs, there's a risk of serotonin syndrome, which is caused by overdose. Serotonin syndrome is the overproduction of serotonin, which can be fatal, with symptoms that can be mild, which is shivering and diarrhea, or severe and can lead to seizures.
Hi Jennifer, how are you?
I'm good.
That's good. So it looks like you're working your medical history there?
Yep, I'm just filling it out for you.
I'll just give you a few minutes to finish it.
Yeah. Alright, I think I've got everything on there.
Alright, I'll take a look at it. So before we start our cleaning today, I'm just going to go over your medical history.
Sounds great.
Let's see here. Any changes in the last 6 months that I've seen you?
I'm currently on a new drug called Eldepryl for my Parkinson's disease.
Okay. Let's see here. So when did you start taking that drug?
About a month ago.
A month ago, okay. Eldepryl for Parkinson's disease. Okay, let's see here. So I'm just going to give you a little side effect that can happen, okay?
Okay.
During the cleaning, you might feel kind of dizziness, lightheadedness, drowsiness may occur. You might feel like fainting, which is syncope, abdominal discomfort, confusion, hallucinations, and nausea, okay?
Okay.
And during those times, if you feel anything like that, let me know. And to make some, to reduce the risk of dizziness, when you lay down for a long period of time during cleaning, I would slowly raise you up so you don't have any lightheadedness. If you do, let me know. We'll stop and let you rest for a little, okay?
Okay.
For dry mouth, I would recommend you to use biotin rinse.
What is that?
It's a rinse that's with fluoride in it.
Okay.
So you can buy that over the counter at Walgreens, Target, the drug place area.
Okay.
Try to choose sugar, less gum. That will also help to produce saliva in your mouth so it's not so dry.
All right.
Have you encountered these side effects before?
Dizziness for sure.
Dizziness.
Yeah.
Okay. So I just want to ask you a question. What would you do to reduce the risk for being dizzy when I'm sitting you up?
Okay. Oh, thanks. So for dizziness, you would have to reduce the syncope, which is the fainting. You would have to sit up after supine position, which is slightly back with your feet elevated. You'd have to be sit upright for 2 minutes before standing, so that will prevent the syncope. You'd also want to monitor the vital signs at every appointment. You want to check for the salivary flow to prevent caries and periodontal disease, which is caused by the xerostomia. And then the last thing would be to assess for extra pyramidal motor symptoms, and this can be caused by drug-induced movements, which can complicate the dental treatment. And this would be things like spastic muscle spasms, twitching, anything that can harm yourself or the dental hygienist if you were to knock off some of the tools or move when she's in your mouth. That could be very dangerous for both people. So
sounds good. I'm at least know. I'm glad. Thank you. So I'm just going to touch your back and do some cleaning. Now that you know that, I just want you to, did you have someone here to drive you home just in case there might be drowsiness that may occur?
No, but I could call my husband if I had to.
Okay, good.
Yeah.
All right. Well, we'll continue cleaning.
All right, sounds great. Thank you.
Thank you, guys.
Thank you.